What's going on, everybody? This is Motorcycle Mouse. We got a lot to cover today. This is going to be a little bit of a longer moto vlog, so we're going to kind of jump right into it. I've got some pictures for you today of all the medical equipment that I was talking about in the last video, and also we're going to go over a little bit about how to use it, and basically consider this a very basic first aid course. So if you're at the scene of an accident, specifically if you ride in groups, you'll know at least what not to do. So first thing, the last video, I left some things out. We're going to talk about those today. And like I say, I pulled out my own first aid kit. I'll show you how big it is. I got a picture of it I'll put up right now. As you can see, it's not very big at all. Fits into saddlebags very easily. So it shouldn't take up very much room. Now, I will say that the Sam Splint CPR mask and J-tube does not fit in that. It has its own little pack, but they take up another, maybe a handful. It's the Sam Splint's the biggest part. Okay, so the last moto vlog that I did went over really well. Everybody seemed to like that subject, so I figured I'd go a little bit more in depth on it. This is going to be a little bit longer just because of the subject, so you know, if you find it boring, this is not the moto vlog for you. Okay, so the first thing that we're going to talk about is when you get on scene. Like I said in the last video, your biggest issue is making sure yourself does not become making sure you do not become a casualty yourself. So don't run out in front of traffic trying to get to a wreck that you just saw. Don't run straight. Damn, dude, take the fucking turn. My bad. People are being stupid today, y'all. I got cut off by a lady earlier. I'm talking, I had to lay on the brakes, and she laughed about it. She thought it was funny. I was so mad. So anyway, my bad. So anyway, you get on the scene. What you want to look for is hazards to yourself while you're putting on your gloves. So you should have gloves. I got a picture of those. And preferably the non-latex kind, because some people are allergic to latex. But here's the thing. If you're working on them, odds are they got bigger problems. So if I have latex gloves, sorry, I'm working on you. If you're allergic to them, you'll figure it out when you get to the hospital. It's not going to be one of those life-threatening issues. I'm going to secure your airway anyway. Okay, so you're putting on your gloves. You're looking at the scene of the accident, right? You're looking at what caused this accident. Now, most likely, considering what we're talking about, it's going to be a motorcycle accident, and that's kind of a straightforward thing. You don't have to really think about it. But let's say you just came up on an accident and you don't know what happened. It could have been a gas leak. It could have been electrical. There's all kinds of things that you have to worry about, including oncoming traffic, to make sure that you don't just become another casualty at the scene of the accident. So that's the first thing, is scene safety and BSI, which is body substance isolation, which is what gloves are. Gloves are body substance isolation. In other words, your spit, your blood, your mucus, your whatever you have coming out of your body doesn't end up in my body. So body substance isolation, or BSI. For now on, we'll call it BSI. So, alright, after BSI and you're checking the scene safety, the next thing you're going to do is you're going to figure out, okay, do I need backup? Which, yes, you should call 911. The next thing that you're going to do is figure out, okay, C-spine, and do I need special equipment? You're not going to have special equipment. 911's going to figure that out. But you're going to consider C-spine, okay? Especially in a motorcycle accident, yeah, go ahead and pretend that their neck is broke, okay? Unless you saw them lay down and say their chest hurt and they just laid down softly, you should pretty much always consider C-spine and pretend that their neck is broken. Because you don't know how they ended up in the floor, blah, 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 right? Okay, so after you consider C-spine, the next thing you're going to do is you're going to figure out their level of consciousness. If they're laying there screaming at you, they're conscious. If they're just laying there and they're not responding to you, they're unconscious. There's two in between, which is verbal and painful. Verbal means they only wake up when you're talking to them. Painful means they only wake up when you do something that hurts. Okay, here's the thing. If they're unconscious, they're usually an easier patient to work on. I know that sounds bad, but if you're unconscious, you're not screaming, you're not moving around, you're not freaking out, I would personally rather work on an unconscious patient. Out of all the patients I've worked on, the unconscious ones are by far the easiest ones to work on. Next thing you're going to do, the biggest part, once you actually get to the patient, you're going to say, hey, I'm such and such, are you alright, or are you okay? That's what you're doing to figure out their level of consciousness. And then you're going to make sure they have an airway. If they're talking to you, they have an airway. If they're screaming, they have an airway. They have an airway and they're breathing. So it's pretty simple in first aid. It goes A, B, C's, right? A, B, C, D, E, F, G. Same thing once you get to them. A is airway. So there's two types of techniques. There's the old head tilt chin lift that everybody hears about in like the very basic first aid. And then there's another one called the jaw thrust maneuver. And I don't have a picture of that, but basically what that is where your thumbs are pressed on the cheekbones, two fingers behind their jaw, and you push, and what that does is it pushes their mouth forward really slightly and secures an airway. But what that does is that ties you up. Now you can't complete your assessment. So it's better to have tools. So tools for getting an airway. The first one is called an OPA, or an oral pharyngeal airway. I know this is a thick subject, but it's going to take me a while to get through all this, so that's why I'm kind of talking fast, guys, and I'm trying to go as fast as I can with it. But I have pictures of this. It's an OPA for now on, not an oral pharyngeal airway. What that is a J-tube, and it goes in the mouth sideways, and you rotate it down as it goes in the mouth, and it pulls their tongue forward and it secures an airway. They can now breathe. If they did not have an airway, this will secure an airway. It's also big enough for the suction device to go into. If you had a suction device in the hospital, they'll use that J-tube and they'll suck out blood or teeth or anything else that's in the throat that's trying to block the airway. So the biggest thing that you worry about on the scene is an airway, because it doesn't matter if you complete the rest of the assessment. If the patient never had an airway, they're dead by the time you're done with the assessment, or at least have brain damage. Okay, so airway. Then second thing you worry about, A, then B. B is breathing. You're going to check the patient for breathing. Is the patient breathing? You want to look, listen, and feel. You're going to look for the rise and fall of the chest. You're going to listen for any wheezing noises or anything like that. And put your ear down next to their mouth and see if you can hear them breathing. And you're going to feel by placing your hand softly on the chest and see if it's rising or falling. Basically, 12 to 20 is the average rate of breathing. If they're breathing too fast, you really don't have to worry about it. That's just them kind of panicking because they just had an accident or whatever. That usually will calm down. It's when they're breathing too slow that you want to worry about. That's the one. If it's below about 12, you want to start worrying. You want to start breathing for them. You would use something like the bag valve mask or one of the CPR masks that you have to breathe for. You breathe into it with a CPR mask, but it's a lot more compact. But a bag valve mask is the best one. It's the one I was talking about in the last video, where you just squeeze it. You count 1, 2, 3. 1, 2, 3. That's how fast you want to do that. You don't want to just hyperventilate your patient. Okay, so breathing. You want to look for the quality of breathing. How are they breathing? Noted. You know, there's not much you can do other than either breathe for them. If they're breathing 12 to 20, leave them alone. They'll be all right as far as breathing goes. Now, all this that you're taking note of, you want to kind of take a mental note of this, okay? That way, when you come back to this part later on and you're basically checking yourself, if their breathing rate is all of a sudden collapsed and going downhill, then you know, okay, first the patient was stable, now they're going downhill. Or first the patient was downhill, now they're stabilizing, so on and so forth. That way you know what your patient's doing. Okay, A, B, C. C is circulation. This is where you want to check and see if your patient is bleeding, and you do what's called a blood sweep. And a blood sweep is simply, you have your gloves on now, you start at the head and you reach back as far as you can without moving the patient's C-spine, and you're going to pull your hands out. Do they have blood on them? No. Put your hand under the neck, pull them out. Do they have blood on them? No. Put your hand on their shoulders. Do they have blood? So on and so forth, all the way down the body, all the way down it. You'll check their crack, and if it's a female, you'll check that area. You do what's called a credit card sweep. That will, either one of those bleeding is internal bleeding. And then at this point in circulation, if they are bleeding, this is where you're going to use the things like your gauze pads that I was talking about the other day. And with a gauze pad, you actually have to plug the wound. And on circulation, you only worry about life-threatening bleeding. You don't worry about little bumps and scrapes and things like that. If it's just barely bleeding, leave it alone, you'll come back to it. On circulation, only life-threatening bleeding are you worried about. If they're just pouring blood, then you'll stop right here in the assessment and you'll take care of that with something like the quick clot or a tourniquet or something like that. Now, I don't encourage you guys to do tourniquets, and the reason being, yeah, we use tourniquets in the military, and it's one of the first things we use actually. But I'm not going to tell a bunch of YouTubers to do it, because if you place a tourniquet on wrong, it causes more damage than it does good. Now, used to, if I put a tourniquet on you, whatever limb I put the tourniquet on, you're gonna lose. That's not true anymore. You can wear a tourniquet more than 8 hours now, and they can still save that limb. That being said, if you don't place the tourniquet on properly, it turns into a bad situation. Let's say you get your foot blew off. If I put a tourniquet right above that, like they used to say, you know, if I put it right above it, okay, those two bones basically have to be pressed really hard for it to cut off the circulation good enough for the blood to stop. And that usually doesn't happen. The tourniquet usually isn't tight enough. So the biggest thing for you, if you're going to use a tourniquet, put it on really tight. That's all I can tell you. It's going to hurt your patient. Your patient's going to be in pain if you do it. But it is a life-saving measure. Right above that, you have the knee and the joint, and that usually comes undone. Right above that, you have where your veins in your leg dive to go through the knee. So basically, if I'm going to put a tourniquet on your leg, I'm going to put it all the way up at the very, very top of your leg. Yeah, you're going to be in pain, but that's pretty much the only secure place to do it. I'm getting a little too much into tourniquets, and we have a lot more to cover for this not to be a hugely long video, but I wouldn't encourage tourniquets unless you absolutely have to, okay? And if you do, put it on tight and put it on right. All right, so life-threatening bleeding is all you're worried about during this part of your patient assessment, okay? Then you go to D. So A, B, C, D. D is your decision to transport. You've already made that decision. If you've called 911, you've got somebody en route and somebody's coming with an ambulance. So you really don't have to worry about that, but that's a part of the assessment. Okay, how are we going to get them out of here? And how are we going to transport them out of here? So if you're off in a embankment or something like that, you need to start looking at, okay, how are we going to get this patient out of here? Do we need a chopper to come in and take these, you know, guys out of the woods here, because we can't get them back up the bank that they came off of, so on and so forth, okay? All right, E is your examine. This is your bread and butter of your patient assessment. Examine, you're looking for what they call DCAP BTLS. That's DCAP BTLS, okay? That stands for basically anything that is not normal on the human body. Deformities, contusions, abrasions, penetrations, lacerations, tenderness, swelling, so on and so forth, okay? DCAP BTLS, you don't really have to remember that. You just basically, if it wasn't on your body or a normal human body, note it down. If this person had a face this morning and now they don't have a face, note it, okay? You're going to have to come back to it and take care of it. So you need to, basically this is the part of the assessment where you're like, all right, they've got burns or they've got a stab wound here, you know, so on and so forth, okay? And you take care of it. I need to go back to that parking lot because yesterday I shot a video doing lean limits. It was really a boring video, but I lost one of my bells. I drug the bell off the floorboard. Doesn't matter to this video. Anyways, okay, so during the examine, this is where you'll actually stop all the small cuts. This is where you'll take care of everything that you can, and you'll also check your other life-saving measures that you've used up to this point. You will check and make sure that the airway that you used is actually still in, is doing its job. You'll check and make sure that the life-saving hemorrhaging or bleeding measures that you use, such as a tourniquet if you did put one on, or gauze if you did pack a wound, or quick clot if you use that. You'll make sure all that's still doing its job. So, okay, then after examine, F, focused history, which is basically just, you really don't have to worry about that being a first responder. If you don't have any training, don't worry about that one. I'm thinking. I'm trying to go through this as quickly as possible, and then we'll talk about some of the equipment I was talking about the last time. Okay, so we'll talk about some of the equipment. Okay, there's the OPA, which we already talked about, the oral pharyngeal airway, the J tube. Okay. The only time that you can use a J-tube, it's a life-saving measure. It secures an airway, but usually the only time you can use that is if your patient is unconscious. Because if they're conscious and they have a gag reflex, they tend to puke that thing back up. So they came out with an NPA, or a nasal pharyngeal airway. I'll put a picture of it now. This little green tube basically goes up the nose and secures an airway. Now, this is kind of a weird, painful feeling. It's not horrible painful. We've done it to ourselves in medical school. You just put this thing in. But it comes with like a little lube in the pack, and you put that lube on it so it doesn't make their nose bleed and things, and then you put it up their nose, and it secures an airway that way, and you can actually breathe for them with a bag valve mask and things like that over something like that. It's a way to secure an airway. Okay, the only time you wouldn't use that is if they had some horrible facial trauma and you thought that tube was fixing to go into their brain. So OPA and NPA. I prefer the NPA because I don't have to worry about you having a gag reflex, and it doesn't matter whether you're conscious or not. I just put this thing up your nose and you're good to go. If you can't get an airway that way, it's time for a trachea where you cut their throat open, and I'm not going to talk about that on YouTube. Look up your own videos on that one. I'm not going to be liable for that. I'm going to go ahead and turn around and go back the other way. So anyway, okay, let's see. Gauze, I showed a picture of. Pack the wound. Quick clot. Quick clot is very expensive, and it used to burn. Now the quick clot, they have quick clot gauze, and it's basically a gauze embedded with that powder, and it's a lot less likely to get into the first responders' eyes and blind them for life. But basically same thing. Pack the wound. Only quick clot gauze works 10 times better than regular gauze as far as packing the wound, but it does create a glue type substance on the patient's cavity. Whatever happened that they're bleeding so bad, it'll create like a glue type substance. It's kind of a pain in the ass for them in the emergency room, but you did save your patient's life. And it's not going to be that big of a deal in the emergency room because they're going to have to clean all that out anyway. So let's see, what else am I forgetting? For airway, another piece of equipment, we have the OPA, the NPA. We talked about the bag valve mask. The one that I carry generally is a CPR mask. It's a little collapsible fold-out CPR mask that a bag valve mask will hook up to. That way, if I just need to breathe for somebody, I can breathe for them. But it has this little stopper filter thing on it. That way, if they aspirate or they puke or whatever, it doesn't go up in my mouth. I'm trying to think of what other equipment that I took pictures of today. That super glue. Okay, super glue. If you carry super glue with you, it's very small, and it can help you close up some of the wounds in a pinch. Super glue is basically medical glue without the smell or burning sensation. It's the same thing basically. Let's see, super glue. Carry some bandages, carry some of the small things. Like I say, guys, my pack, when I took the picture of it, it's smaller than my hand is, really. I mean, it's really small. It fits in your saddlebags pretty easy. So if you're if you're trying to be the designated medic, you could fit a lot more inside your pack. A lot more. You could carry a lot of things such as the C-collar that we talked about the other day, and that would be something to control the C-spine from moving around. You could carry a sked. You could even carry a fold-out stretcher, one of the smaller ones, but I wouldn't really even worry about that. I'm going to let the patient stay where they're at unless they hit a tree and the tree's about to fall on them or some shit like that. I'm not fixing to try and move them. I'm going to let the ambulance get there with the proper stretcher. I think that's about it, guys. So just a quick recap. You get on the scene. Once you get on the scene, you make sure that you're safe as you're putting on your body substance isolation gear, such as gloves, mask, whatever. At least gloves. Okay, so you're checking the scene. You're making sure that it's not dangerous for you to enter that scene. Once you check and make sure that it's not dangerous to enter that scene, somebody's calling 911, right? Okay, after somebody's called 911, you're saying to yourself, okay, I need backup and I need special equipment. Are we going to have to airlift this guy out of here? Are they going to need a rebreather? Are we going to need the jaws of life? So on and so forth. You're going to consider C-spine. always please pretend that their C-spine has been compromised, that they have a broke neck or broke back. Don't go wiggling them around. Don't, hey, wake up, shaking them, and don't do any of that. Don't let them be moving around, anything like that, okay? Consider C-spine. All right, then airway. Do they have an airway? If not, you're going to give them an airway. You're going to give them an OPA or NPA to make sure, or you're going to do the head tilt chin lift. Don't do the head tilt chin lift because it compromises the C-spine. But you're going to do the jaw thrust maneuver I was talking about. Look up that one. But the best thing to do is go ahead and OPA or NPA. Okay, once you give them an airway, you're going to check for breathing. Are they breathing? If they are, how much are they breathing? Look, listen, and feel. Then you're going to do circulation. You're going to do your blood sweep. You're going to make sure they're not going into shock. I forgot that part earlier. We'll talk about it now, okay? For circulation, you're going to do a blood sweep, which is where you put your hands under the head, see if there's any blood, put your hands under the neck, see if there's any blood, so on and so forth, all the way down the body. While you're doing that, you're going to do things to prevent shock, such as loosen their belt, take any rings that they have off so that if their hands swell, it doesn't cut off circulation. Take off anything that is constricting blood flow. You're going to loosen their shoes, you're going to loosen their belt, you're going to take off any tight clothing that they have. It needs to come off so that their circulation can flow freely so they don't go into shock if they haven't already gone into shock. Okay, then you're going to make your decision to transport. Okay, how are you going to get this person out of here? Has 911 been called? And if so, how are they going to get them out of there? So on and so forth. Then you're going to do your examine. Okay, when you examine, basically decap BTLS, anything out of the ordinary. Hard stuff, soft stuff, squishy stuff, wet stuff, anything that's not ordinary, you need to note it down and you need to fix it if you can, if you have the proper equipment. Okay? Then when you're done doing all that, start over. Start over and check everything you just did until the medics get there. Because when the medics get there, they're going to do the same exact thing. They're going to start completely over, and the whole way to the hospital, they're going to go A, B, C, D, E, F, and then they go start back over there. A, B, C, D, E, F, A, B, C, D, E, F. They just do it over and over and over until they get to the hospital. They're going to make sure that the patient is as stable as possible by the time they get to the hospital. Alright guys, I'm sorry if this went on a little long. I had a lot to cover. I hope I've put the pictures in the proper place and all that sort of thing. If I think of anything, I'll put it in the description if I think of anything that I forgot. So just kind of, I guess check the description every now and then. So I hope you guys like this video. Thanks for watching. I'll be back to you as soon as I can with another one.
We're doing donuts. Without the ice.
Everybody say hey.
What?
Everybody say hey.
What? Where?
I guess that'll have to do. Cue that outro music.